My name is Chaz Jackson. I'm a physical therapist assistant here at Barkman Smith Physical Therapy. Hopefully you had a phenomenal day, and thank you so much for taking the time out of your busy schedule to be here with us. It means the world to me. Thank you so much for being in tune with our social media, with the likes, the shares, and just giving so much information on what you want to see and how we can improve your quality of life. And I just want to throw out there as well any physical occupational topics that you would like us to cover on our social media as far as videos goes, or any upcoming posts. Please let us know. We're here to serve you, care about you, and serve you. So super excited about giving more information on that. So with further ado, I want to introduce this gentleman here. So this is Chaz Jackson. He's a intern here at Barkman Smith Physical Therapy, and I just want to ask him a couple questions before he get ready to interview me. Christian, I'm going to introduce you to the audience here, and can you just share a little bit about your experience as far as your internship here at Barkman Smith Physical Therapy?
So first I want to start out with the people who work here. I feel like they do a very good job creating relationships with the patients here. I feel like that's a big part in helping them get through their exercises or their recovery process. Everyone's really nice here. They make you feel welcome here. That's, I feel like, to me, is the number one most important thing for recovery, to get their people's mental health right for this recovery process. The second big thing, I feel like they're very organized here. They have a nice system that they go through. It's just very organized, barely any waiting, and it's nice.
Yeah. Hey, I love it, man. Thank you so much. And is there any encouraging words? Someone's looking at us right now, they're thinking about pursuing physical therapy, they're looking for a place to go. Any encouraging words?
Definitely, if you're thinking about it, don't be afraid to just jump in, and then when you do start, don't be afraid to buy in. Go all in with the exercises. I feel like for me personally, during recovery workings, once you get started, it might be a little shaky at first, or you're not sure about it, but once you really buy in and really focus on wanting to get better and allowing them to help you to get better, it'll go by really fast, and you'll start to improve in no time.
Nice. Thank you so much for sharing. And again, thank you for being here, interviewing me. You're ready to start up. So there's some questions that you are supposed to be asking me.
So first question I got is, what is your favorite thing about working in physical therapy?
My favorite thing about working in physical therapy, so I had a lot of time to think about this. It seems like a lot of providers as well before me. I think that my most favorite thing about physical therapy is there is always something new involved, whether it's with patients, research. I feel like there's never a conveyor belt based lifestyle within the therapy world. Like, you're always learning and growing, and again, there's always new research out there to challenge the way you're doing things at the present time. So I think that's the most favorite thing about physical therapy for me.
I think that's same for me. It's never the same old thing every day. That's why I kind of got into it.
Yeah.
So second question, where did you grow up? Where are you from?
So originally from North Carolina, grew up in Forest City, North Carolina. So been in Texas here about it'll be 2 years this upcoming November. Me and my family moved out here November 2020. So
Yeah.
originally from Carolina. Go Tar Heels.
I'm from here, so yeah, I don't know about that. So what's your favorite thing to do? What's your hobby?
Hobby. So I think for me right now at this season in my life, my hobby is family. So recently my baby boy, he'll be 6 weeks old tomorrow, actually, Nico. So he's definitely taking up a lot of my time, and which no judgment involved with that. I really enjoy him, my family, my girl. I have 2 older daughters, so enjoy spending time with them, my wife. Also, the reason I actually moved to Texas was to help assist with a church plant. So one of my biggest things outside of therapy is really being involved in the church, Redemption City Church. We planted in Fort Worth, Texas. So I love being with my church family, where I love working out And I love also having an opportunity to go and just serve young men and women, our next generation, through speaking endeavors, coaching, and things of that nature. So, yeah.
I think that's a great motivation, and congratulations on the being
Yeah,
boy.
thank you.
Of course. So, fun question: what's your favorite food?
Man, anything that's cooked, man. So for me, gosh, I love like Italian-based food, like pizza. That's always given. But when I think about like my favorite food, my wife, she makes this awesome lasagna. I love lasagna in general, but she makes this lasagna where she has these different layers. Like she'll have beef on one layer, and she'll have pepperonis on another layer, and she'll have sausage on another layer, and it's just like tons of cheese. I'm like, I love like pasta based stuff. Lasagna, pasta. Yeah, that's kind of my go-to.
Yeah, I like chicken Alfredo pasta.
Yeah, chicken Alfredo. Stuff like that.
And I also like shrimp too.
Yeah.
Sometimes shrimp pasta. So I rarely love shrimp,
but a nice runner-up is Mexican food. Man. I like
my family is a big fan of that, so I eat that sometimes. But those are good answers. I like those. So, as a healthcare provider, in these past years of experience, what is your favorite body part to treat, you think?
My favorite body part to treat, I just love discovering about the whole body, but if I had to narrow it down to one thing, I like shoulders. Like, I feel like shoulders, it does so much. There's so many planes from the shoulder, so many different dynamics from the shoulder. So, I feel like you can learn a lot. Treating the shoulder and learning the mechanical and anatomical aspects of the shoulder. So,
so why did you become a physical therapy assistant?
Great question. So for me, I think the seed was planted for me my senior year in high school. I got hurt the third day of the season, fractured my lower leg, thought my career was over. You know, for me growing up back in Forest City, I grew up in home beginning, so I knew my family wouldn't technically be able to afford to send me to school. So sports, that gave me hope. That makes sense. And growing up in the environment I grew up in. So for me, when I got hurt my senior year, it was like, oh man, like what's going to happen? Recruiting's going to fall apart. But long story short, I met a therapist. His name was Brandon. I still remember him to this day. And he pretty much told me, he said, Chaz, if you do what I tell you to do, I can get you back to play. And I was like, really? You know, I'm talking like, hey, you can get me back. And he was like, yeah, I can get you back. So he did get me back, and I was able to continue my career. And I don't know, fast forwarding through life, I remember, again, Brandon popped back up in my head, and I was just like, I'm going to do that for someone else. So I think that was the ultimate ideal that kind of inspired me. And for me, I've been doing exercises pretty much all of my life, being in sports. I know you're a student athlete yourself, so it just kind of came natural for me.
I feel like that's also the reason why I got in. I also got hurt junior year, and that kind of brought me along this path of physical therapy. And also one little quick thing, I feel like what you said, that's like kind of an example of buying in and trusting someone and creating that relationship, that bond to help you get through the process. Like if you seem lost or something, I feel like especially this place is a good place to start, build a relationship and get through a hard time.
Yeah, no, I'd just like to speak that for all the other providers here. I think that really attracted me to even stay at this clinic because people really care, and Brandon cared, and I know how he made me feel, like you were saying, and I want to do that for someone else. I want them to come to us. We get a lot of people come to us, you know, at a low state, and we're able to get them back to doing the things they love to do, and that's what I love. I love about this job.
So, favorite question, one I've been wanting to know. What is a little known fact that people will be surprised to know about you?
Well, I think there's a lot of little ones, but for some reason, like I'm leaning towards this just because football. So I talked about Brandon, and he got me back. So little known fact, I got a full scholarship to play D1 football, and also I like to brag on this. Carolina Panthers, Matt Rule, the head football coach there, he actually coached me. He recruited me, and he paved the way for me to be able to play collegiate football and get that full scholarship. So, yeah, so I think it's kind of neat to say you've been coached by a professional head coach.
I say that all the time.
Yeah, man.
Yeah. All right, so that's it for my questions. Now we'll go to the live stream, see any questions y'all have. So First one, what is your favorite sport?
Good question. My favorite sport. So growing up, I was huge. I love basketball. Like that was my first love. But you know, my dribbling was like below average. Like I was a big man. Like I could jump. I remember. Yeah, so I played like 4 and 5. But I just stopped growing. Like I stopped at 6 feet even, in most 4 and 5s. You know, making it to the collegiate level. Like that's very rare. Yeah. So. I have to say, starting out with basketball, but definitely as I progressed and started cultivating the sport, football kind of took over. So.
I feel like those are my top two. Yeah. Football, I enjoy playing it, but basketball, I love watching it. So we're not the same. Second question. So I hear you do some motivational speaking as well. Is that true? Is that right?
That is true. That is true. So I'm a big advocate. I'm very passionate about personal development and leadership. I think over the years, I've discovered some things, some solutions to some of the problems that I experienced growing up, and I love pouring into young people, young men and women, but particularly young men. So I have a platform called Gift and a Gift, and what that is a platform for young men to come to get tips and techniques on how to grow in personal development and leadership. So through that platform, our motto is you're gifted differently to make a difference. Mm-hmm. And I feel like that gift inside of you is there to give to others. So I have some amazing people that I've connected with through that. That comes on to Gift and a Gift, which is a podcast, and just share their story, share how they're impacting in your lane and how to help uplift young men. So yeah, I've been able to, been very, very blessed and grateful to be a part of that platform. And also that platform has created windows for me to, go to schools and work with nonprofit organizations to come and speak on various programs that I offer.
That's pretty cool. I think that's very important.
Yeah.
I'll check that out.
Yeah, definitely check it out.
Along with that question though, how did you get into motivational speaking?
Really good question. I think again, me growing up in humble beginnings, for me in my environment, in my neighborhood, it was normal for me to see alcohol, drug-related activity, domestic violence. So, for me, looking back now, it created a lot of self-limiting beliefs for me, and it took a coach, another individual. So, throughout all my experiences, I published a book. It's Live, Learn, Lead Powerfully. It's a team leadership guide. I talk about Brandon in that book, but I also talk about a coach, Coach Cosby. Now, I mentioned me growing up in those humble beginnings. A lot of times I was against a lot of black men growing up in this neighborhood. And I met Coach Cosby. He installed hope into me. He helped cultivate my football career. And he helped me get rid of some of those limiting beliefs. So along my roller coaster of a journey, we all have our stories. And, we all have our trials and tribulations and ideals. But, over the years, me making a lot of mistakes, as many of us do, I started learning and understanding some solutions from some of the problems that I was dealing with. Some of that was some self-esteem issues, some poor social skills, if you will. So as I began to learn some solutions from some of the problems that I was dealing with, I was like, man, I have to give back. Me being a Christ follower, that was a huge impact in my life as well, becoming a Christ follower. And the more I learned, the more people was pouring into me, like Coach Cosby, like other mentors and mentees and things of that nature. I just began to learn a lot of personal development and leadership. And again, I just wanted to share. I wanted to set up a platform where, a young person can look at me and say, hey, Chaz, you already made those mistakes for me, so I don't have to make those mistakes. So, and again, you can't, we can't control the cards that was dealt to us, but we can control how we play our hand. So you can always find someone in a similar situation that you necessarily can't completely change their environment, but you can change their perspective of where they're looking at things. So that's something I'm super passionate about.
That's pretty cool. Yeah, I feel like you'll definitely be like a Coach Cosby or a Brandon for someone else later down the line doing this type of stuff, and affect them like the way they affected you.
Yeah, thank you so much.
Yeah. So, next question: How have your experience as a physical therapy assistant helped with motivational speaking, and vice versa?
Wow, that's a really good question. You know, I think earlier in my career, I had two different hats with both of them. And I think the more I grow, the more I'm wanting to blend both of them together because it's all, you know, personal development, it's all helping, it's all serving. So I feel like it helps me a ton. I think motivational speaking, physical therapy, I think it has helped me, you know, grow as far as being humble. It helped me grow with learning about people. It helped me grow about in regards of learning personalities, how to approach people, how to, you know, to have conversations. I think being in the therapy world is one of the biggest things to remember. You know, the good Lord, the big man upstairs, gave us 2 ears and 1 mouth. So I think being in the therapy world, it really cultivated me listening more and really using critical thinking, problem solving. And I think that kind of transitioned into speaking as well, because a lot of times, you know, I'm in a situation where I'm talking with a principal or a counselor, and I'm really wanting to listen more versus saying what I'm going to do for them, but really diving into what is your pain points. And I think we do that both in the therapy world and in the speaking world, is understanding what people's pain points are and really dissecting that and seeing how I can serve. You know, because it's not about Chaz Jackson, it's way bigger than me, and this is the way I approach things. So I think the moral of what I'm sharing is, I think, you know, in both worlds, listening was a huge part, and just really understanding, hey, how can I serve this individual? What are they telling me? Am I listening to and looking at all of the clues to know how to approach that situation in the best way possible? So
I definitely see that. So next question, what is your favorite manual therapy?
My favorite manual therapy? Wow. I guess joint mode is always cool, you know, shoulder, inferior, superior, posterior modes, knee modes, dynamics that help facilitate more range of motion, whether we're talking about the shoulder or the knee. I think that's always cool, depending on, you know, patient tolerance, whether it's in grade 1, 2, 3, or whatever the case may be. So mobilizations are pretty cool, and just to see how that mechanical change of doing that mobilization, and just seeing the patient's face, like if, you know, they wasn't going as far, and you doing that technique, and they're like, oh man, you know, my arms moving a little better. I feel like that's something that you can use, and again, depending on the client that you're working with, that can get some change quicker, and kind of get that client on your side and say, hey, there is some hope to get back, if that makes sense.
So it kind of goes along with like the shoulder being like your favorite part to work on, kind of for that same reason.
Yeah, because I guess, and I know I got my PTs back here, but you know, the shoulder, you can, that joint, you know, you can do a lot of variations of mobilization. So you can, again, depending on the plan of care, depending on the diagnosis, you can be a little creative and experiment. Yeah, based on what their restriction is in that plane, that range of motion plane.
So do you have one experience as a physical therapy assistant that you would like to share? Maybe a favorite moment, favorite experience you've gone through?
Wow, that's a good question. Good question. As a physical therapist assistant, my favorite moment. So for me, I got my license in 2015. A lot of things, it seems like me and my family, we're always on this roller coaster. Things I always have. So right when I got my license October 2015. Prior to that, my firstborn child was Zuri. She was born August 15th of that year. And I remember me and my wife was talking about traveling. And we was like, wow, if we're going to do this, we need to do this now, because Zuri's going to grow. I know when she starts school, it's going to be hard to travel. So for me, there was so much fear involved, because I was fresh out of school. I was like, man, if I jump into traveling right now, I know it's going to be tough. But, you know, by the grace of God, we took that leap of faith, and then I started traveling. And that May 2016, so I worked in the outpatient, and I started traveling right away. And I bring that up because it was like a culture shock, to be honest. Like, I remember going to the skilled nursing facility, and if you come in as a traveler, they're paying a lot of money for you to be there. So they're gonna give you the worst patients ever. They're gonna give your productive rate is gonna be sky high. Like they're gonna expect the most out of you. So for me, being somewhat of a new grad and just trying to figure things out, I feel like I was thrown in the fire. Like it stands out a lot to me. But the more of me bringing that up as experience, I feel like that helped grow me a ton. It helped me adapt a lot quicker. Doing traveling, I was doing 3-month contracts, so I would go to different places and I would see so many different ways therapists, clinics was doing things, and I feel like that helped mold me to adapt to people, environments a lot better. So it was a very fearful thing, but for me, you know, at times you have to get comfortable being uncomfortable. It kind of goes back to me moving out here in Texas during COVID. It was an uncomfortable situation, but I think it was one of the best situations or the best decisions that my family could have ever made being here.
That's good. I'm glad you're here in Texas.
Yeah, thank you.
So this is more of like a broad question. What is one of your biggest accomplishments in life?
Wow. One of my biggest accomplishments in life. I think my biggest accomplishment in life is building a relationship with my Lord and Savior Jesus Christ. That's my biggest accomplishment. That transformed my life, me becoming a Christ follower. Again, being a guy I was in a broken state at one point in my life. I remember me graduating school and not having football anymore. I kind of went in this depressive state at one point in my life, and it took me down a rabbit hole, and me becoming a Christ follower at that time and really cultivating my relationship with the Lord, really getting around good spiritual leaders to help build me back up because I was broken. That really helped me a ton. I know my wife's probably listening too. She's right under there. She's under there, but she's right under there. My wife is. She's an amazing individual. I wouldn't have came out of that brokenness without her. But I have to say that was my biggest accomplishment, was learning about Jesus and how he transformed my life.
I'm glad you're doing well now.
Yeah.
You're doing really good for yourself.
Again, I'm not perfect. I'm still learning. I don't have all the answers, but I'm willing to try. I'm willing to keep learning, keep asking questions. I encourage you to do that throughout your career. Don't be afraid to ask for help and to ask questions. That's something for me that I'm still learning to do, but because I'm starting to do those things, my life's been transformed. So
that's good. So I believe this is the last question. So what is your favorite part about working at Barkman Smith Physical Therapy?
My favorite part? There's a lot of favorite parts. I think my favorite part about working at Barkman Smith Physical Barkman and Smith Physical Therapy is being around a group of individuals that show empathy, show that they care. I go back to when I was traveling, and I've been in some clinics that was just really doing it really bad. You know, it wasn't the patient wasn't the first priority. And I can say in my this upcoming October will be 7 years for me. This has been one clinic that I feel that each and every provider truly cares about their client. They want to listen. They want to get them better. They want to get them back doing the things they love to do. And that's contagious. That's something that's very rare to find. It's something, and I tell all the providers this, you know, being with a group of or team that's together, one mind, and have the same goal in mind for the clients, get them better, improve their quality of life, get them doing the things that they love to do. That is a very good thing, and I think you know, just from my short period of time being here, to be 2 years in December, just the clients that's returning back to this clinic, the individuals that's raving about Barkman Smith Physical Therapy, you know, all that matters, you know, and that stuff's something that you cannot ignore. So I think the way that we care about our clients, that's one of the biggest things that stands out to me. And it's very important. That's one of the reasons why I got into this, because a therapist named Brandon doing some of the same things that these clinicians here are doing. So I think that's our questions, really good questions. Had me thinking. But again, reach out if you have any other questions for me, for anyone here at Barkman Smith Physical Therapy. We want to, again, care, value, and serve you, and your opinion truly matters to our team here at Barkman Smith Physical Therapy. And continue to tune in. More videos are coming soon. Be on the lookout for them. Continue to stay safe and upright from all of us here at Barkman Smith Physical Therapy. And I just want to say thank you as well for coming and spending time with us.
Thank you, Howard.
All right, guys, you have a good rest of your evening.